COVID-19, also known as the coronavirus disease 2019, is a respiratory illness caused by the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The outbreak of this novel coronavirus was first identified in Wuhan, China, in December 2019 and quickly spread worldwide, becoming a global pandemic. As of my last update in September 2021, COVID-19 had caused significant health, social, economic, and psychological impacts across the globe. Health effects. COVID-19 primarily spreads through respiratory droplets and close contact with infected individuals. The virus can cause a range of symptoms, from mild to severe, or even be asymptomatic. Common symptoms include fever, cough, fatigue, and difficulty breathing. Severe cases can lead to pneumonia, acute respiratory distress syndrome, ARDS, and multi-organ failure, often requiring intensive care and mechanical ventilation. Older adults and individuals with underlying health conditions are more vulnerable to severe illness and death. The pandemic put immense strain on healthcare systems worldwide, overwhelming hospitals and healthcare workers. The demand for medical supplies, including personal protective equipment, PPE, ventilators, and hospital beds, skyrocketed. Frontline healthcare workers faced physical and emotional exhaustion while battling the virus. Social effects. COVID-19 significantly disrupted daily life and social interactions. Governments implemented measures like lockdowns, quarantines, and social distancing to mitigate the spread. Schools and businesses closed, leading to job losses, economic instability, and financial hardships for many individuals and families. The pandemic forced people to adapt to remote work and virtual interactions. Events, gatherings, and celebrations were canceled or moved online. Social isolation and loneliness became prevalent issues, particularly for vulnerable populations like the elderly and those living alone. Education faced unprecedented challenges with the shift to remote learning. Students lacked access to necessary technology, and educational disparities were exacerbated. Many students struggled with online learning, leading to concerns about learning loss and its long-term impact on their educational outcomes. Economic effects. The COVID-19 pandemic caused a severe economic downturn globally. Businesses, especially small and medium-sized enterprises, faced closures, and many industries, such as tourism, hospitality, and aviation, suffered significant losses. Unemployment rates surged, leading to financial hardships for millions of people. Governments and central banks responded with economic stimulus packages and monetary policies to support businesses and individuals. However, the economic recovery was slow and uneven, exacerbating existing inequalities between different socio-economic groups. Psychological effects. The pandemic's psychological impact was profound, with increased stress, anxiety, and depression reported worldwide. Fear of the virus, uncertainty about the future, and feelings of isolation took a toll on mental health. Frontline workers experienced immense stress and trauma, witnessing the devastating effects of the virus daily. Many people grieved the loss of loved ones without the opportunity for traditional mourning rituals. Misinformation and conspiracy theories surrounding COVID-19 further fueled fear and uncertainty, making it challenging to disseminate accurate information. Vaccination efforts and hope. Vaccination campaigns were launched globally to combat the spread of COVID-19. Multiple vaccines were developed and approved for emergency use. Vaccination efforts aimed to achieve herd immunity and reduce the severity of the disease. While vaccines brought hope for controlling the pandemic, challenges such as vaccine distribution, vaccine hesitancy, and emerging variants continued to impact the global response to COVID-19. The COVID-19 pandemic has been an unprecedented global crisis with far-reaching effects on health, society, economy, and mental well-being. The world united in its efforts to combat the virus, with scientists, healthcare workers, and communities working together to find solutions. The pandemic highlighted the importance of preparedness for future health emergencies and the need for international cooperation in addressing global challenges. As the world continues to navigate the pandemic's complexities, it remains essential to prioritize public health, equity, and solidarity to build a more resilient and inclusive future.